So let's start with our case study. Our case is about a 12-year-old girl that's presented to the emergency room with symptoms of fever, headache, abdominal pain, vomiting, and yellowish discoloration of eyes with 5 days of duration. The physical examination revealed there's marked pallor, fever, tachycardia, tachypnea, and icterus. There was no lymphadenopathy, edema, rash, petechiae, or bruises. Cardiovascular examination revealed a 3 to 6 systolic murmur along the left sternal border, non-tender soft hepatomegaly with a span of 14 cm and a soft spleen 3 cm below the left costal margin was noted. Lung fields were clear and neurological examination was normal. Fundoscopy revealed dysedema, rough spots, fusiform dilation of veins with extravasation and arteriolar hemorrhages. Diagnosis shows that the patient is suffering with mixed autoimmune hemolytic anemia, which is also known as MAIHA. And now let's have a little history about National Blood Bank. It was started in 1955, initiated by a group of women volunteers of the Red Cross British, and due to increasing services, they moved to another building at Hospital Kuala Lumpur in 1971, and they are known to be the National Blood Service Centre, and they are inaugurated in April 1972 by Director General Health, Ministry of Health. Starting from 1975, they play an important role in the standardization of work procedure, methodology, reagent, and blood bank equipment in all new buildings negara. In year 2002, National Blood Centre was built in Jalan Tun Razak and it was inaugurated by the Director Datuk Sri Hasbah Muhammad Ali. The objectives of National Blood Bank includes create and maintain a safe blood donating environment for the donors, provide blood and blood components that are safe, adequate, and appropriate screening procedure in practice, and storage of blood products in accordance with international standards. They also ensure optimal patient care through the use of blood and blood products. And lastly, they establish and maintain cooperative relations through training, research, and development in line with the needs of the practice and the latest technology in the medical field today.
There are different types of activities done in the National Blood Bank. The PDN carry out daily activities of collecting, processing, and supplying blood and blood products for patients in government and private hospitals of Kuala Lumpur and Putrajaya. Secondly, they are also responsible for processing and conducting blood screening tests for the blood collected from Selangor, Negeri Sembilan, and also West Pahang. PDN also organize seminars, workshops, and conferences targeting to provide training services. Besides, PDN provide professional services on blood donation, medical transfusion, platelet serology testing, microbiology, and also hematology.
How does the daily activity of National Blood Bank help with patients with MAIHA? Those patients often present with severe hemolysis and they need blood transfusion. While their red blood cells are coated with multiple autoantibodies, both warm reactive IgG and cold reactive IgM autoantibodies are present in the serum. These serological complexities not only render a cross-match incompatibility but often lead to blood group discrepancy. Daily activities of collecting, processing blood, and supplying blood to the patient of MAIHA will help to sustain their life.
What we actually found interesting in the National Blood Bank is firstly, the workers in the National Blood Banks, where they actually provide a good aseptic techniques, attitude, caring, and also kind. Secondly, there are a variety of people that can actually come to donate blood. National Blood Bank has actually become a good communication place and also bonding between peoples. People actually willing to come and also donate blood to help the society. And lastly, what we found interesting is actually the procedure to explore our blood. The simplicity of modernized equipment made to draw blood is at ease. Patient will relax when the blood will draw.
Different types of blood components like packed red cells, platelets concentration, and also platelets.
And now we're going to talk about the criteria to donate blood.
Age between 18 and 60 years old. For those less than 18, written consent from parents or legal guardian is required. Body weight of at least 45 kg, in good physical and mental health with no chronic medical illness, not on long-term medication, and has not been intoxicated by alcohol within 24 hours prior to donation, should not be fasting and have had enough sleep more than 5 hours the night before donating, and last has been staying in Malaysia for at least 1 year for non-citizens. For apheresis donors, aside from the criteria above, there are few additional criteria they have to fulfill, like age not more than 55 years old, body weight of more than 55 kg, have donated whole blood at least twice before and the last donation was not more than 6 months ago, and lastly, having a suitable venous access.
Next, we are going to talk about the process of blood donation.
First, donor will first need to fill out the blood donation registration form or card. Second, have their body weight. Third, have a blood test to identify the blood group and hemoglobin level. Fourth, undergoes pre-donation counseling by medical officer or nurse. Fifth, if qualified, have their details registered and blood donation book issued. Sixth, this is followed by the blood donating process itself that will normally last between 7 to 15 minutes. After the donation completed and needle removed, the donor needs to rest for at least 10 minutes before getting off the bed. And last, donor will then be served with light refreshment.